Hello and welcome back to Humana Insurance video tutorial series, guys. So in today's video tutorial on Humana Medicaid 4.2, we will be diving deep into three crucial topics which are essential for understanding and maximizing the benefits of your Humana Medicaid. And these three topics are: number one, finding the provider; number two, using your benefits; and number three, understanding the costs. Well, if you did watch the video tutorial of Humana Medicaid 4.1, then I would suggest you to watch that video first and then continue watching this video. If you are a new member or trying to refresh your knowledge, then let me tell you, this video tutorial is going to give you a valuable insight and practical tips, guys. So by the end of this video tutorial, you will have the comprehensive understanding of these key areas, empowering you to make informed decision and take full advantage of Medicaid plan, guys. So let's get started. So, finding a provider. How to use the Humana provider directory to find doctors, specialists, and hospitals within the network. Then tips on what to consider when choosing a provider. The importance of staying within the network to avoid additional costs. So guys, we are going to understand these points in details. All right, so let's understand these points one by one. Okay, so how to use the Humana provider directory to find doctors, specialists, and hospitals within the network. Using the Humana provider directory to find doctors, specialists, and hospitals within the network is a straightforward process. Here is a step-by-step guide. Accessing the Humana provider directory. Number one, visit the Humana website. Go to the Humana website, guys. Number two, navigate to the provider directory. On the home page, look for a link or tab that says Find Doctor or Find a Provider. This is often found in the main menu or under a Member Resources section. Searching for providers. Number one, select your plan type. Choose the type of plan you have. For example, Medicare, Medicaid, individual and family plans, etc. This ensures the search results are tailored to your specific coverage. Number two, enter your location. Input your zip code, city, or state to find providers in your area. You may also be asked to specify the distance you are willing to travel. Number three, specify the type of provider. Choose the type of provider you are looking for. Doctors and specialists. You can select general practitioners or specialists, for example, cardiologists, dermatologists, etc. Then hospitals and facilities. You can search for hospitals, clinics, urgent care centers, and other facilities. Number four, advanced search option. Use advanced search option to narrow down your results by filtering providers based on gender, language, language spoken, availability of telehealth services, office hours, accepting new patients, ratings, and reviews. Now, reviewing search results. Number one, examine provider listings. The search results will display a list of providers that matches your criteria. Each testing type, each listing type, each listing typically includes provider's name and specialty, contact information and address, distance from your location, network status, for example, in network, patient ratings and reviews,
Additional information such as office hours and languages spoken. Number two, view detailed profiles. Click on provider's name to view a more detailed profile. This profile may include education and qualifications, board certifications, hospital affiliations, detailed patient reviews, accepted insurance plans. Contacting providers. Number one, make an appointment. Use the contact information provided to call the provider's office directly and schedule an appointment. Confirm that they are in network and accepting new patients before scheduling. Number two, online appointment requests. Some providers may offer the options to request appointments online through the Humana directory or their own websites. Additional tips. Number one, verify coverage. Always verify with both Humana and the provider's office that the provider is in network and covered under your specific plan. Number two, use Humana's mobile application. Humana's mobile app can also be used to find providers. Download the app and log in with your member credentials to access the provider directory on the go. Number three, keep records. Print and save the details of the provider you are interested in for easy reference. Following these steps, and you can efficiently use the Humana provider directory to find doctors, specialists, and hospitals that meet your needs and are within your network, guys. Now, tips on what to consider when choosing a provider. So, when choosing a Humana provider involves several considerations to ensure you receive the best possible care tailored to your needs. Here are some tips to help you make an informed decision. Number one, verify network status. In network providers, ensure the provider is in network to maximize your insurance benefits and minimize out of pocket costs. Out of network providers may result higher costs. Number two, specialty and expertise. Primary care physicians, which is also called as PCP, choose a PCP for general health needs and preventive care. Your PCP can also provide referrals to specialists. Specialist. If you have specific health conditions, look for specialists, for example, cardiologist, dermatologist, with expertise in that area. Now, number three, location and accessibility. Proximity. Choose a provider conveniently located near your home or workplace. Now, office hours. Ensure the provider's office hours align with your schedule. Some providers offer evening or weekend appointments. Number four, credentials and experience. Board certification. Check if the provider is board certified in their specialty. Years of experience. Consider the provider's experience, especially for complex health issues. Number five, patients' reviews and ratings. Feedback. Look at patients' reviews and ratings on the Humana directory or other review site to gauge patient satisfaction and provider quality. Recommendations. Ask for recommendations from friends, family, or other healthcare professionals. Number six, hospital affiliations. Affiliated hospitals. Which hospitals the provider is affiliated with, especially if you may need hospital care. Ensure these hospitals are also in network. Number seven, communication and language. Language. If you prefer a provider who speaks your language, filter your search accordingly. Communication style. Choose a provider whose communication style matches your preferences for discussing health issues and treatment options. Number 8, availability and wait times. New patients. Ensure the provider is accepting new patients. Wait timings. Consider the typical wait times for appointments and the provider's availability for urgent needs. Number 9, telehealth services. Virtual visits. If you prefer or require telehealth services, check if the provider offers virtual consultation. Number 10, insurance coverage. Coverage details. Confirm that the provider accepts your specific Humana plan and verify what services are covered to avoid unexpected costs. Number 11, personal comfort and compatibility. Comfort level. It's important to feel comfortable with your provider. Trust and good communications are key to effective healthcare. Cultural sensitivity. Consider if the provider understands and respects your culture and personal health beliefs. Number 12, preventive care and health management. Health programs. Some providers participate in health management programs that could benefit you, such as chronic disease management or wellness programs. Number 13, referrals and authorizations. Referral requirements. Understand if the provider requires referrals for specialists and how the referral process works. Number 14, follow up and continuity of care. Follow up and continuity of care. Continuity. Choose a provider who offers good follow up care and ensure continuity, especially if you have ongoing health issues. Tips on All right, so tips on what to consider when choosing a provider. Now, here are steps to use Humana's provider directory. Number one, access the directory. Go on the Humana website and navigate to the provider's directory. Number two, enter your information. Input your location, plan type, and other filters. Number three, review listings. Look through the list of providers, paying attention to their profiles. Number four, contact providers. Call the provider's office to confirm details and make an appointment. By carefully considering these factors, you can choose a Humana provider that best meets your healthcare needs and preferences. The importance of staying within the network to avoid additional costs. Staying within the network is particularly important for Medicaid recipients enrolled in Humana's plans because it can significantly impact your out of pocket costs and access to care. Here are key reasons why staying in network is crucial. Number one, cost savings. Lower out of pocket costs. In network providers have pre negotiated rates with Humana, which usually results in lower co-payments, co-insurance, and deductibles for you. No balance billing. In-network providers agree to accept the insurance payment as full payment for covered services. Out-of-network providers may bill you for the difference between their charges and what your plan pays, a practice known as balance billing. Number two, full coverage of services. Medicaid requirements. Medicaid plans typically have strict network requirements. Using in-network providers ensures that you get the full coverage of services as defined by your plan. Avoiding denied claims. Services from out-of-network providers may be denied or reimbursed at a lower rates, leading to higher personal expenses. Number three, coordinated care. Better care coordination. In-network providers are part of an integrated systems that facilitates better coordination of care. This is especially important for managing chronic conditions and ensuring all aspects of your care are covered and coordinated. Referrals and authorizations. Your primary care physicians, which is called as PCP, within the network can provide referrals to specialists and other healthcare services, ensuring smooth transitions and coverage continuity. Now, number four, access to quality care. Credentialed providers. Humana's network includes providers who meet specific credentialing requirements, ensuring a standard of quality care. Comprehensive services. In-network providers are more likely to offer a full range of services covered by your plan, including preventive care, specialty service, and hospital care. Now, number five, ease of navigation. The importance of staying within the network to avoid additional costs. And number five, ease of navigation. Simplified billing. Using in-network providers simplifies billing and reduces the chance of unexpected costs. Humana processes claims directly with in-network providers, making it easier for you to manage your healthcare expenses. Now, transparency. Humana's provider directory and customer services can help you understand your benefits, costs, and coverage, ensuring you make informed choice about your healthcare. Now, the importance of staying within the network to avoid additional cost. Here are tips to stay in network. Okay, use the provider directory. Number one, regularly check Humana's provider directory to find and confirm in-network providers. Number two, confirm before appointments. Always verify with the provider's office and Humana that the provider is still in network before scheduling appointments or receiving services. Now, number three, get referrals and authorizations. Ensure you obtain necessary referrals and authorizations from your PCP or Humana before seeing specialists or receiving specific treatments. Now, number four, understand your plan. Familiarize yourself with the specifics of your Medicaid plan, including covered services and network requirements. Now, consequences of going out of network. Number one, higher costs. You will likely face higher out of pocket cost for out of network services. This includes higher co-payments, co-insurance, and potentially the full cost of service if they are not covered. Number two, limited coverage. Out of network services might not be covered at all, especially for non-emergency situations. 3. Balance billing. You may be responsible for the difference between the provider's charges and what Humana reimburse, leading to significant unexpected expenses. Staying within the network is essential to manage healthcare costs effectively and ensure you receive the full benefit of your Humana Medicaid plan. It ensures access to coordinated, high quality care while minimizing your financial burden. Now, six, using your benefits, guys. How to use the Humana Medicaid member card, how to schedule appointments, and what information to provide, how to access prescriptions, medications, and the process of getting them filled. Now, guys, we are going to understand these step by step. All right, so let's select one topic. The first topic, how to use the Humana Medicaid member card. Using your Humana Medicaid member card correctly is essential for accessing your healthcare benefits and ensuring smooth interaction with healthcare providers. Here are detailed steps and tips on how to use your Humana Medicaid member card. Receiving and understanding your card. Number one, check the card details. Personal information. Ensure your name and other personal information on the card are correct. Member ID. Note your member ID number, which you will need for healthcare services and inquiries. Plan details. Your card may include information about your specific plan and coverage. Using your member card. Number one, keep it accessible. Carry your Humana Medicaid member card with you at all times. You will need to for all healthcare visits, including doctor appointments, hospital stays, and pharmacy visits. Number two, presenting your card. At doctor's visit, show your card when you check in for appointments. This always the provider to verify your coverage and ensure services are billed correctly. At the pharmacy, present your card when picking up prescriptions to ensure you receive the correct coverage for medications. In hospitals, provide your card upon admissions to ensure all services and treatments are covered appropriately. Using your card member. Number three, confirm coverage. Verify your benefits with the provider's office uh, before receiving any services. Now, you have to verify your benefits with the provider's office before receiving any services. This ensures that the services you receive are covered under your Humana Medicaid plan. Now, additional tips for using your Humana Medicaid member card. Number one, update your information. Notify Humana. If any personal information on your card changes, like for example, name, address, then contact Humana to update your details and request a new card if necessary. Number two, understand your benefits. Read your plan documents. Familiarize yourself with your coverage, including what services are covered, co-payments, and any necessary pre-authorization requirements. Use Humana resources. Access the Humana website or app to review your benefits, find in-network providers, and manage your health information. Number three, know how to get help. Customer service. If you have questions or need assistance, contact Humana's customer service using the phone number or the back of your card. Phone number on the back of your card. Online tools. Use Humana's online tools and resources to find providers, check claims, and manage your health benefits. Number four, emergency situations. Emergency care. In an emergency, seek care immediately and provide your Humana Medicaid member card as soon as possible to ensure coverage. Replacing your card. Number one, lost or stolen card. Contact Humana. If your card is lost or stolen, contact Humana immediately to report it and request a replacement card. This helps prevent misuse of your benefits, guys. Online request. You may be able to request a replacement card through the Humana website or mobile app. Now, how to use Humana Medicaid member card, managing your health with your member card. All right. Number one, routine and preventive care. Schedule regular checkups. Use your card to access covered preventive services such as annual physicals, immunizations, and screenings. Follow up care. Ensure that any follow up appointments or specialist visits are covered by showing your member card. Number two, medications. Prescription coverage. Prescription coverage. Present your card at the pharmacy to obtain medications covered under your plan. Check it check if prior authorization is needed for certain prescriptions. Number three, specialists and hospital services. Referrals. For specialist care, obtain a referral from your primary care physician if required by your plan. Inpatient and outpatient services. Show your card for hospital admissions and outpatient procedures to ensure proper billing and coverage. By keeping your Humana Medicaid member card handy, understanding your benefits and following these tips, you can effectively navigate your healthcare services and maximize your Humana Medicaid benefits. Now, how to schedule appointments and what information to provide. Scheduling appointments for Medicaid through Humana involves a few key steps, and you will need to provide certain information to ensure a smooth process. Here is a detailed guide to help you through it. Number one, identify your healthcare needs. Determine the type of appointment you need, such as primary care visit, specialist consultation, or routine checkup. Number two, locate a Medicaid provider within Humana's network. Ensure that the provider you choose accepts Medicaid and is within Humana's network. You can do this by visiting Humana's website and using their provider directory, calling Humana's customer services to get a list of Medicaid providers. Now, number three, contact the provider. Once you have identified a suitable provider, you can schedule an appointment by calling the provider's office directly, using Humana's online appointment scheduling tool if available, using any patient portal services offered by the provider. Number four, information to provide. When scheduling the appointment, have the following information ready. Personal information, your full name, date of birth, address, and phone number. Insurance information, Medicaid ID number, Humana member ID, and any other relevant insurance details. Reason for appointment. Be specific about why you need the appointment. For example, is it a routine checkup, specific symptoms, follow up visit? Okay, now preferred dates and times. Have a few options ready to make scheduling easier. Previous medical records. If it's your first visit to the provider, ask if you need to bring any medical records or if they can be transferred. Number five, confirmation and preparations. Confirm appointments. Make sure to get a confirmation number or email. Prepare for visit. Gather any necessary documents such as ID, Medicaid card, list of medications, and any questions you have for the doctor. Sample steps. Number one, find a provider. Go to Humana's website and use the provider search tool. Call Humana customer service at the number on your card for assistance. Number two, schedule the appointment. Call the provider's office and say, "Hello, I am Humana Medicaid member and I would like to schedule an appointment." Provide your personal and insurance information when asked. Number three, prepare for the appointment. Make sure you know the location of the provider's office. Bring all necessary documents, including your Medicaid and Humana ID cards. By following these steps and ensuring you have all the necessary information at hand, you can efficiently schedule an appointment for Medicaid through Humana. How to access prescription medications and the process for getting them filled. Accessing prescription medications and getting them filled through Medicaid with Humana involves several steps, from obtaining the prescription to picking up the medications. Here is a detailed guide to help you navigate this process. Number one, obtain a prescription. Visit a healthcare provider. Schedule an appointment with your primary care physician or a specialist within Humana's network. Get the prescription. During your visit, your doctor will write a prescription for the necessary medications. Ensure it is an electronic prescription sent to your chosen pharmacy, or obtain a written prescription. Number two, choose a pharmacy. Find a participating pharmacy. Make sure to use a pharmacy that accepts Humana Medicaid. You can find participating pharmacies by checking the Humana website and using the pharmacy locator tool. Calling Humana's customer service for assistance. Preferred pharmacies. Some plans may have preferred pharmacies where you may receive better pricing and additional benefits, guys. Number three, provide necessary information to the pharmacy. Prescription. Provide the pharmacy with the prescription details if it is not sent electronically. Insurance information. Show your Humana Medicaid card and any other insurance details. Personal information. Verify your name, date of birth, and address to ensure they match what is on file. Number four, fill the prescription. Pharmacy processing. The pharmacy will process the prescription, verify your Medicaid coverage, and prepare the medications. Copays. Depending on your specific Medicaid plan, you may have a small copay for the medications. Confirm this with the pharmacy. Number five, pick up your medication. Notification. Many pharmacies will notify you via text, call, or email when your prescription is ready for pickup. Identification. Bring a valid ID and your Humana Medicaid card when picking up the medications. Review instructions. When you receive your medications, review any instructions provided by the pharmacist. Now, additional tips. Refills. For medications with refills, ask your pharmacy about their process for requesting refills. Many pharmacies offer automated refills services. Mail order. If your plan includes a mail order pharmacy option, consider using it for long-term medications. You can typically set this up through Humana's website or customer service. Medication management. Keep a list of all your medications and their doses to help manage your health and for references during medical appointments. Now, common steps in the process. Now, how to access prescription medications and the process for getting them filled. Common steps in the process. Number one, visit your doctor. Get a prescription written or sent electronically to your chosen pharmacy. Number two, choose and visit a pharmacy. Ensure the pharmacy accepts Humana Medicaid. Provide your prescription and insurance details. Number three, waiting for processing. Allow the pharmacy time to process your prescription and verify coverage. How to access prescription medications and process for getting them filled. Here is number four, pick up medication. Bring necessary ID and Humana Medicaid card. Pay any required copays and review instructions. By following these steps, you can effectively access and manage your prescription medications through your Humana Medicaid plan. Always keep in contact with both your healthcare provider and pharmacy to address any issues or questions that may arise. So, number seven, understanding costs. So, in this topic, we are going to cover three important crucial points. Number one, cost structure for Humana Medicaid members, including copays, premiums, if any, and out of pocket costs. We'll also cover how to read and understand billing statements, guys. And we will cover tips for managing healthcare costs effectively. So we are going to understand these topics in details. All right. So let's move on to the next slide. Now, cost structure for Humana Medicaid members, including copays, premiums, if any, and out of pocket costs. The cost structure for Humana Medicaid members typically includes copays, premiums, if any, and out of pocket costs. These costs can vary based on the specific Medicaid plan you are enrolled in, as well as the state you reside in. Since Medicaid programs are jointly funded by states and the federal government and managed at the state level. Number one, copays. Copays are small, fixed amount that you might be required to pay for certain healthcare services and prescriptions. The exact copay amount depend on the type of service and your specific plan. Common copays may include doctor visits from $0 to $5, specialist visit from $0 to $10, emergency room visits from $0 to $10 if not admitted, prescriptions from $0 to $3 for generic drugs, and from $0 to $8 for brand name drugs, guys. Now, cost structure for Humana Medicaid members, including copays, premiums, if any, and out of pocket cost. This is the topic which we are on currently. And in that topic, we are on second point, that is premiums. Okay. Now, most Medicaid, let's go back for a while. Okay. All right. So, point two, premiums. Most Medicaid recipients do not have to pay premiums. However, some Medicaid programs, particularly those for children, which is also called as CHIP, or certain Medicaid expansion programs might have minimal monthly premiums. These are usually very low compared to private insurance premiums. It is important to check your specific plan details for any applicable premiums, guys. Now, point three, out of pocket costs. Now, out of pocket costs for Medicaid members are generally minimal due to the programs designed to assist low income individuals and families. However, you might encounter the following: deductibles, rare in Medicaid plans, but if present, they are typically very low. Cost sharing. Limited cost sharing provisions may apply, but federal regulation cap the total out of pocket spending for Medicaid enrollees to ensure affordability. Then, non covered services. You may have to pay out of pocket for services not covered by Medicaid, although these are usually limited. Summary of costs. Here is a summarized breakdown of potential costs: copays, doctor's visits $0 to $5, specialist visits $0 to $10, emergency room from $0 to $10 if not admitted. Okay, prescriptions from $0 to $8 depending on generic or brand name. Premiums usually $0, but some Medicaid expansion programs or CHIP may have small premiums. Then out of pocket costs, generally minimal with low or no deductibles and limited cost sharing, guys. Additional considerations: state variations. Since Medicare is state administered, cost can vary significantly by state. Always refer to your state's Medicaid office or your Humana plan details for specific information. So always refer to your state's Medicare office or your Humana plan details for specific information. Special population. Some population, such as children, pregnant women, and those with disabilities, may have different cost structures with reduced or eliminated copays and other costs. How to get specific cost information. Now, cost structure of Humana Medicaid members, including copays, premiums, if any, and out of pocket cost. So, here is how to get specific cost information. To get the most accurate information about specific cost structure, you should check your plan documents, review your Humana Medicaid plan documents or member handbook. Contact Humana customer service. Call the number on your Medicaid card for detailed information about your benefits and costs. Visit your state's Medicaid website. They provide comprehensive details about covered services, copays, premiums, and other costs. By understanding these elements, you can better manage your healthcare expenses under Humana Medicaid. Now, how to read and understand billing statements. Reading and understanding billing statements from Humana or any healthcare provider can be complex, but breaking it down step by step can help. Uh, Here is a guide to assist you. Number one, personal information and account details, name and address. Ensure that your name, address, and other personal details are correct. Account number. This unique identifier is crucial if you need to contact Humana regarding your bill. Number two, statement date and period. Billing period. This indicates the dates for which services were billed. Ensure the date match the time frame you received services. Number three, summary of charges. Total amount due. This is the overall amount you owe. Due date, the date by which the payment must be made to avoid late fees. Number four, itemized list of services. Service date, the date on which each service was provided. Description of service, a brief description of the medical services and procedure. Provider, the healthcare professional or facility that provide the service. Charge, the amount billed by the provider for the service. Number 5, insurance and adjustments. Insurance payments, amount paid by Humana on your behalf. Adjustments, discounts or adjustments negotiated by Humana with the provider. Patient's responsibility, the amount you are responsible for after insurance and adjustments. Number 6, explanation of benefits. Explanation of benefits, which is also called as EOB in short. Often a separate document from Humana, an EOB provides a detailed breakdown of what was covered by your insurance, what was not, what wasn't, and why. Allowed amount, the maximum amount Humana agrees to pay for a service. Covered amount, the portion of the allowed amount paid by Humana. Non-covered amount, what you might owe due to non-covered services or exceeding plan limits. Now number 7, payment information. Previous balance, any unpaid amounts carried over from previous statements. Payment and adjustment payments or adjustment, any payments you have made since the last statement or adjustment made by Humana. Number 8, how to pay. Payment options, instructions for paying your bill, which might include online payments, mailing a check, or paying by phone. Number 9, contact information, customer service, phone numbers and addresses to contact Humana for any questions or disputes. Now, tips for understanding your Humana billing statements. Number 1, compare with EOB. Always compare your billing statement with your EOB to ensure all charges are correct. Number 2, check for errors. Look for any discrepancy or errors in billing. Common errors include duplicate charges or charges for services not received. Number 3, understand your coverage. Familiarize yourself with what your Humana plan covers to better understand why certain charges were applied. Number 4, keep records. Maintain a file of all medical bills, EOBs, and payment receipt for future references. Number 5, ask for clarification. If you are unsure about any part of your bill, contact Humana's customer service for clarification. By carefully reviewing each section and comparing it with your records and EOBs, you can better understand your Humana billing statement and ensure its accuracy. Now, tips for managing healthcare cost effectively. So here are the tips, guys. Managing healthcare cost effectively. when using Humana's Medicaid plan involves a combination of understanding your coverage, utilizing available resources, and making informed decisions. Here are some tips to help you manage your healthcare cost effectively. Number one, understand your coverage. Know what's covered. Familiarize yourself with your Medicaid plan benefits and what services are covered. This includes routine checkups, emergency services, prescriptions, and specialized care. Stay in network. Use healthcare provider and facilities that are within Humana's network to avoid extra charges. Out of network services often cost more and may not be covered fully, guys. Now, number two, preventive care. Regular checkups. Take advantage of preventive services such as annual physicals, screenings, and vaccinations. These services are often covered at no additional cost and can help detect issues early, avoiding more costly treatment later. Healthy lifestyle. Maintain a healthy lifestyle through diet, exercise, and avoiding smoking. This can reduce the need for frequent medical visits and treatments. Number three, prescription medication. Generic medications, whenever possible, choose generic drugs instead of brand names ones. Generic are usually much cheaper and are just as effective. Formulary list. Use the formulary approved drug list provided by Humana to ensure your medications are covered and to find the most cost effective options. Number four, utilize available resources. Telehealth services. Use telehealth services for non emergency situations. These virtual visits can be more convenient and less expensive than in person visits. Community resources. Look for community programs and resources that offer free or reduced cost services such as health fairs, clinics, and support groups. Now, number five, emergency versus non emergency care. Urgent care. For non life threatening issues, consider urgent care centers instead of emergency room. ER visits are significantly more expensive. 24/7 nurse line. Use Humana's 24/7 nurse advice line for guidance on whether you need to see a doctor or go to urgent care. Number six, budgeting and financial assistance. Set a budget, plan, and set aside money for healthcare expenses, including copays, deductibles, and any other out of pocket costs. Financial assistance programs. Investigate if you qualify for additional financial assistance programs to help cover costs. This includes programs for low income individuals or those with high medical expenses. Number seven, review statements and bills. Regularly check statements. Review your billing statements and explanation of benefits EOBs carefully to ensure accuracy. Disputes any errors with Humana immediately. Understand cost. Be aware of what each service costs and what portion is covered by Medicaid. Ask your provider for a cost estimated before undergoing non emergency procedures. Number eight, plan ahead. Annual plan review each year Review your Medicaid plan during the open enrollment period to ensure it still meets your need and that you are maximizing your benefits. Schedule appointments wisely. Schedule routine appointments and follow ups in a way that makes the best use of your plan's benefits and minimize costs. Number nine, effective communication. Ask questions. Don't hesitate to ask your healthcare provider questions about your treatment options, costs, and alternative therapies. Stay informed. Keep yourself informed about any changes to your Medicaid plan or Humana's policy that might affect your coverage and costs. Number 10, Health Savings Account, which is also called as HSAS. Okay, HSAs. Now, eligibility. If applicable, consider setting up a if applicable, consider setting up a health saving account which is called as HSA to save pre-tax dollars for healthcare expenses. Note that HSAs are typically for high deductible health plans, so check eligibility under Medicaid rules. By understanding your coverage, making smart healthcare choice, and utilizing available resources effectively, you can manage your healthcare costs more efficiently while ensuring you receive the necessary care.
So guys, that's all about this video tutorial. I hope that you found this video useful. If you enjoyed watching this video, then make sure that you hit that like, subscribe my channel and click that notification bell so that you don't miss any updates, guys. Alright, so thanks for watching and see you in my next video on Humana Medicaid 4.3. Till then, bye bye.